Stool routine examination, also known as a fecal analysis or stool analysis, is a laboratory test that examines a sample of stool, feces, for various components, including microorganisms, parasites, blood, and other substances. It is commonly performed to aid in the diagnosis of gastrointestinal disorders, infections, and other conditions affecting the digestive system. Purpose: 1. Diagnosing gastrointestinal infections. Stool examination helps identify bacteria, viruses, or parasites that may be causing gastrointestinal infections, such as bacterial gastroenteritis or parasitic infestations like amoebiasis or giardiasis. 2. Detecting digestive system disorders. The test can indicate the presence of digestive disorders like inflammatory bowel disease, IBD, Crohn's disease, or ulcerative colitis by examining the presence of blood, mucus, or other abnormal substances in the stool. 3. Evaluating malabsorption. Stool examination can help diagnose malabsorption syndromes, such as celiac disease, by checking for the presence of fat globules or undigested food particles in the stool. 4. Screening for colorectal cancer. Testing for hidden blood in the stool can be done to screen for colorectal cancer or precancerous conditions, although other tests like colonoscopy are typically more accurate for detecting this condition. 5. Monitoring treatment effectiveness. In cases of gastrointestinal infections or disorders, stool analysis can be used to monitor the effectiveness of treatment by checking for the presence of pathogens or other abnormal components in follow-up samples. Procedure: 1. Collecting the sample. A clean, dry container is provided to collect a fresh stool sample. 1. It's important to avoid urine or water contamination during collection. 1. A small amount, about the size of a walnut, is sufficient for testing. 2. Labeling. The container should be labeled with your name, the date and time of collection, and any relevant information provided by your healthcare provider. 3. Submitting the sample. The sample is submitted to the laboratory as soon as possible. 3. If there is a delay, it should be stored in a cool place or refrigerated to prevent bacterial growth. 4. Laboratory analysis. In the laboratory, the stool sample is processed and analyzed. 4. The specific tests conducted may vary depending on the purpose of the examination, but they commonly include: macroscopic examination. The sample is visually inspected for color, consistency, presence of blood, mucus, or undigested food particles. Microscopic examination. A small portion of the stool is examined under a microscope to identify and count different types of cells, bacteria, parasites, or fungi. Chemical tests. Tests may be performed to detect the presence of blood, fat, or other abnormal substances. Culture and sensitivity. In cases of suspected bacterial infection, the stool sample may be cultured to identify the specific bacteria involved and determine their sensitivity to antibiotics. Specialized tests. Depending on the symptoms and suspected conditions, additional tests may be conducted, such as tests for occult blood, ova and parasites, or specific pathogens. Article 1. Clean, dry container. A sterile or clean container should be provided to collect the stool sample. It is important to ensure that the container is free from any contaminants and has a tight-fitting lid to prevent leakage. 2. Gloves. Disposable gloves should be worn by the healthcare provider or the person collecting the stool sample to maintain hygiene and prevent the transmission of any pathogens. 3. Tongue depressor or scoop. A tongue depressor or a clean scoop may be used to transfer a small portion of the stool sample from the toilet to the container. 4. Request form. A request form or laboratory requisition should be filled out with relevant information, including the patient's name, date and time of sample collection, medical history, and specific tests requested. 5. Specimen transport bag. A sealed, leak-proof specimen transport bag may be necessary to ensure safe transportation of the sample to the laboratory. It is important to follow any specific instructions provided by the healthcare provider or the laboratory regarding the collection, handling, and transportation of the stool sample. Proper hygiene practices should be followed throughout the process to avoid contamination and ensure accurate test results. Thanks for watching.